The following video is a demonstration on how to doff personal protective equipment when exiting the room of a patient suspect or confirmed with Ebola virus disease. First, immerse gloved hands in basin of Oxivert TB solution and carefully rub together. While hands are still wet with solution, take wipe and disinfect door handle and plate and allow 1 minute drying time before exiting room. Only one person shall exit the patient room at a time. Enter the anteroom, staying in the half closest to the patient room. This will be marked by the marking tape on the floor. Ensure contact with walk-off disinfectant mat takes place and immerse gloved hands into basin and carefully rub together in Oxivert solution. After door closes, the assistant will enter, staying on the half closest to hallway. The assistant will be wearing scrubs, impermeable gown, one pair of gloves, a procedure or surgical mask, and full face shield. The primary will remove outer set of gloves using glove to glove, skin to skin technique. Immerse gloved hands into basin and carefully rub together. Next, remove gown. Primary will turn around for assistant to undo top and bottom ties. Primary will remove gown. The primary will hook fingers under opposite cuff, pull over hand, and use gown-covered hand to pull gown over other hand. The gown will be taken off slowly and deliberately without touching the outside of the gown and rolled up inside out. The gown will be discarded in a no-touch garbage. Immerse gloved hands into basin and carefully rub together in solution. The assistant will also immerse gloved hands into basin of solution. This is done after each contact with the primary. Shoes/leg coverings are removed next. For balance issues, the primary may need to stabilize him or herself within the anteroom, and the assistant may need to help with the removal of the shoes/leg covers. Both primary and assistant will then immerse gloved hands and carefully rub together in the solution. The primary will then remove face shield using the strap behind the head. Carefully discard. Immerse gloved hands and carefully rub together. The N95 respirator is removed next. If unable to find straps behind head, assistant will help. The primary will have eyes closed during careful removal of the respirator. Both primary and assistant will immerse gloved hands and carefully rub together in Oxivert solution. Always keep in mind gloves should be immersed in solution whenever possible contamination has taken place at any point during PPE removal. Next, the primary will tilt head upwards while assistant will carefully unzip coveralls to lower abdomen. The primary will turn to patient room and assistant will carefully uncover hood from head. The assistant will then peel suit downwards to expose shoulders, allowing hood to be further away from neck. Using outside of sleeves, assistant will remove one sleeve at a time. Assistant will then carefully roll coveralls downward in a manner avoiding contamination of disposable scrubs. Slowly and carefully remove coveralls and discard in no-touch garbage. Both primary and assistant will immerse gloved hands and carefully rub together in Oxiver solution. Inner set of gloves will be removed last, and hand hygiene will be performed with hand sanitizer. The assistant will then face away to one side of the anteroom. The primary will step to the assistant area of the anteroom and untie top and bottom of gown ties. The primary will then exit the room, using caution not to come into contact with the assistant. Immediately clean hands with hand sanitizer. The assistant may then remove gloves using glove to glove, skin to skin technique. Perform hand hygiene using hand sanitizer. Remove gown next. Hook fingers under opposite cuff, pull over hand. Use the gown covered hand to pull gown over the other hand. Pull gown off without touching outside of gown. Roll up inside out and carefully dispose. Perform hand hygiene with hand sanitizer. Next, remove face shield using the strap behind head. Carefully dispose. Remove procedure or surgical mask using the loops or straps behind the ears and ensure the outside of the mask is not touched. Carefully discard. Perform hand hygiene with hand sanitizer. Once completed, the assistant may then exit the anteroom.